ignorance. We're going to be doing a speed debunking on transgenic or transgender mice for $8 million. The $8 million mouse. I might even find an old image to add a mouse head to. Propaganda from basically a conservative version of PETA that massages their egos so that they get some support, but they're identical to PETA, which a lot of you hate because they're activists that will round up and kill dogs and cats in your neighborhood because they have. Period, full stop. So just shut up. The White Coat Waste Project is the darling of one particular part of the political spectrum, but they do exactly the same thing. It's a notorious anti-animal research group. Even if the animals aren't harmed, they're extremists. They were complaining in a paper, if you want to call it, publishing. By the way, no, they're not a reliable source, but they try to cite their sources, at least naming them. That's a minimum. Complaining about 8 studies on the effects of hormones on mice and other animals. This was funded by the National Institutes of Health. Why would you do that? That's obviously what Trump said, blah, blah, blah. Okay, here we go. Question: does estrogen therapy affect your immune response? You know, like your mom who got old enough that her body is no longer making hormones and she's using estrogen therapy or hormone replacement therapy, HRT, to make her body function correctly because she doesn't want to go through menopausal effects like hot flashes and maybe have medical problems. Oh, by the way, she happens to have cancer and she's trying to take medications and this is just one more thing that they can fix by giving her therapy. Yeah, but no, literally shut up. Yes, I know a propaganda source told you their spin on something. If you're going to listen to someone lie to you, listen to someone you would think is lying, tell you the exact opposite and see which one seems more sane. The National Institutes of Health, which a bunch of you have decided is literally the devil, that's literal duty and job is to keep you alive as long as possible for whatever evil thing you think that's for. Now that's not, yes, I know, you'll bring up Fauci and put a devil horns on him and do your memes. Go off to Facebook to do that. You're in my comment section. Because I ain't going to know anything you said otherwise. Does testosterone hormone replacement therapy cause problems and can it be reversed? In this case, infertility. If you're not aware of it, one of the ways men can avoid getting their mates pregnant is to use testosterone, which tricks your body into not making you fertile. Is it reversible? How reversible? This is studied on a regular basis because people do this also because when men get older, the testosterone level drops. You can see advertisements for getting hormone replacement therapy. You just don't call it that because that sounds transgender. No, that's what your mom does or grandma did after she went into menopause because taking estrogen pills or something like it makes her less likely to die from stuff. Same thing with your dad. Your risk of cancer either goes up or down depending on testosterone level. And men, to make sure that they only have children when they want to, apparently it's only for men, I guess, this week, can, well, clear the chamber by overloading on testosterone. Also, testosterone is used for sports enhancement because it's something your body already makes. But I know, what you were told isn't what I'm telling you. But why is the headline in it sound something politically motivated to get people to give them money because people don't want to hear, this is for old ladies who don't want to get sick simply because their body stopped making estrogen, and this is for old men who don't want to lose the ability to have testosterone because, again, they'll get sick and they're more likely to die. Your immune system is dependent on not fucking up your system. But yes, some of you are choking on this because this is about keeping old people from dying early. But it was wrapped up in some bullshit about whatever politically correct statement they had to use because they felt the need to dress it up that way. Some of them are actually studies discussing that as a side benefit, but it's about what effect does estrogen and testosterone have on men and women. There are medical conditions that men have where they're better off taking some estrogen because their body's all out of whack and they're making too much testosterone. Human beings produce hormones, not just one hormone. And not having them in balance means that you get sick. Do hormones change the safety and efficacy of medication or a drug, illicit or legal, prescription or over-the-counter, due to hormones? That could be hormone therapy or just the fact that you're male or female. This is something that was brought up a while ago on a YouTube video I got to watch because someone said, yes, medications are primarily tested on men. They're not tested on women very often, and every once in a while they find a hormone-sensitive side effect that only affects women. The other way around, too. There's a medication I've taken to make sure that my skin didn't rot off of my body because my immune system is heavily damaged because I was being attacked by a bacterial infection. An opportunistic fungal infection attacked me and was eating literally my tissues. This is a medical problem. This can kill you. I know 2 people in Portland that ended up having part of their legs rot off, and it was the fungus that did it partially. In fact, in one person, almost only the fungus eating their flesh. Your skin is your first barrier against disease. So you take the strongest antifungal compound possible, but it's made for women. Is it safe for men to take it? And I'm one of the reasons one of these studies happened because it wasn't particularly safe. I had a horrible, itchy reaction to it, but it was better than losing my right leg. No, it didn't contain any hormone replacement therapy stuff. It didn't. It was literally just an antifungal, originally made for making rope not rot, but it was safe for humans to take. But they only ever tested it on women because women have a higher likelihood of having fungal infections that could be life-threatening. Think your mom or grandma might have died in childbirth because they didn't have medications. But no, this is about transgender mice, or is it transgenic mice? I'm not going to answer the transgenic part. I'll just leave a link to transgenic. But virtually all mice, if you want to push it, someone's going to call them transgenic. Not like I'm talking about the White Coat Waste Project misusing that word a lot. Anything that sounds scary, a propagandist is going to use. Because fear will drive you to be stupid. They don't drive you insane, they drive you stupid. But it wasn't about transgender or anything, but they threw that in there. And yes, some of the studies mentioned that, because one of the effects is people who are transgender take hormone replacement therapy drugs. And when they do that, they jack up the risk of one thing and lower it for another. Because that's already happening and they're medical patients, they can be asked, hey, can we study the effects of this stuff so we can find out if there's something useful? Because some of these things, like estrogen, could be taken by a guy to increase their survival rate for having cancer. It would go on for like 6 months while you're getting chemotherapy, and maybe it'll make you healthier. Same thing with a woman, maybe testosterone would be useful. They need to know whether this works. I'm sorry, but unless you've had a relative die from cancer, you're not going to understand the I don't care what you do, just keep them alive factor. If none of you have had a relative that has died slowly from cancer, you're not allowed to discuss this. I've been scared at one time because of a medical test that I might have cancer. And at that point, I would have literally done anything not to die. But some of you are not like that. This is literally throwing crap on a wall and see what sticks. And if literally just lowering your estrogen or lowering your testosterone or jacking it up to maybe stabilize your body, or maybe throwing it out of whack to make you have a higher likelihood of survival would happen, if you want to state for a fact that you wouldn't do that because politics, then you deserve the negative outcome. Unless you've been faced with death, you don't know what you're going to do, so shut up. Some of you have been faced with death and still say with a straight face, there are some things I wouldn't do. I don't believe you, but I'll accept that you say that. I won't even contradict you, but I don't believe it for a second. Taking a medication for 6 months that might make it to where you don't grow as thick of a beard, or you might grow a beard when you're a woman, versus dying, in some cases in an extremely cruel way that only Satan can come up with, because cancer is the work of the devil. But yeah, a bunch of people are running around taking hormone replacement therapy drugs. They can, in the past, they would get them from someone who had them prescribed. And in some countries, they're not prescribed. They're just something you can buy. Like, a lot of you guys know that you can get testosterone pretty cheaply. In fact, some of you can get a free deal to get some. But for some reason, this is somehow regulated only when we don't like what it might be used for all of a sudden, because all of a sudden you care about it. Didn't Alex Jones sell products like this, including a feminine enhancement thing and a male enhancement thing? What's to prevent me from claiming to be a woman to get it? Nothing. Well, that should be regulated. Now you're talking about the FDA regulating things. That's something you conservatives are supposed to be against because reasons. And again, one of the underground drugs to treat cancer at one time was to name that compound. Some of you are in favor of that. Some of you are in favor of people drinking bleach because you think that removes the bad ethers. But you're bitching about this. Donald Trump was repeating propaganda from a group that's very similar to PETA. That's all I have to say. But they're the conservative version, so they're okay suddenly. And they were complaining about 8 studies out of how many? And it was $8 million out of how many billions thrown away on a jet that doesn't fly correctly? I'm never going to forgive any of you for, well, it's for the government and for the military. Yeah, you're all for it, but it doesn't fucking work. Meanwhile, the F-15's sitting there going, "Hi," and then there's the warthog a bunch of you guys are against because you're freaks. All hail the warthog. But anyway, let's move on. No, really, seriously, fuck you people who don't like the warthog. I don't even know what's wrong with you people. But anyway, there was 8 studies they could find out of all of them that they could bitch about that week. And it was studying the effects of hormones on various medical problems, like if you're sick from something, or if you're taking medication, does it affect it? Or just being male or female, does a medication stop working or make something bad happen? Or does it work better? Again, most medications are tested initially on just men, simply because there's more of them to test it on. Most women aren't in the studies for some reason. You should bitch about that first thing, because there's like half of us are men and half are women. It might be important to test both groups, wouldn't it? You'd be surprised how many medications aren't tested on women, and they find out afterwards, oh, if you happen to have, the hormones of a woman, it, kills you. Yeah. Did I mention thalidomide? No. But we're against the FDA and Fauci and the National Institutes of Health because we look up shit off the internet. The $8 million or more of studies that they were willing to point out are, in the words of everybody at Doge, a drop in the bucket and not a significant or statistically important thing. But you're fixating on it. Trump was, again, misstating, misremembering, or misquoting, or just lying. I prefer saying lying at this point because he could easily check things about a bunch of stuff that was presented by an overt propaganda source that some of you agree with and some don't. But it's still a propaganda source because they lie. They've also been caught doing a bunch of other criminal shit that some of you will say is just fine and some will say is the work of the devil itself because of politics. Here's an idea. Let's hold all of these groups to the same standards because we don't want to appear partisan or just be overtly partisan in every comment section out there and prove to us why we need to have nonpartisan methods. We're currently in an administration that has the White House put up a neener, fuck you attitude article about how Trump didn't lie when he clearly said something that wasn't true. He repeated a falsehood. It takes 2 to lie. 1 to lie and 1 to listen. Well, it takes 3 in this case. 1 to listen, 1 to lie, and 1 to repeat the lie. He's just an intermediate, poor version of a reporter. And I want to point out, having this heavy of a bias in a federal government is something you want to avoid, and it's what people bitch about on one side. This is all payback and punishment and revenge on one side. And you look like shit for doing it. Even if this wasn't really justified, even if it was only perceived injury to all of your hurt little snowflake feelings on the conservative side, it's still the same shit you bitched about. You can't have it both ways. But you have it that way now. Again, $8 million or more spent on determining whether or not a medication will be safe for you simply because you have testosterone or estrogen in your system is not about transgenderism, even if they put that in there somewhere so that they could get people to think, oh, it's one of these politically correct subject matters. No, it's just testing whether or not medication should be tested on men and women because it should. Thanks for watching. Have a good day. Good luck with that. You're all going to need it.